The worst feeling is not being broke. The worst feeling is not that you don't have a property. The worst feeling is not that you don't have a family. The worst feeling is not that you're not married. The worst feeling is actually when you're hospitalized. At that point, everything seems to be useless. At that point, all your properties, all your liabilities, your assets seems to be useless. At that point, your mindset is completely away from your properties and your belongings. At that point, you are fighting to survive. At that point, you are begging God for another chance. Most of you will not relate to what I'm saying. Often at times when I make a video about, your health, right? You just watch and scroll. You don't work with what I say. In January, I made a video concerning medical checkups. Some of my followers actually key to they actually work with what I said. They went to the hospital, and run some checkups for themselves, which is commendable. 80% of these same followers, none of them woke up. Even these basic things I mentioned, none of you did that. Now, you will have yourself to blame because you are informed, but not working with the information you have. You have the information right before you, but you're not using the information to benefit you. So if anything happened health-wise, you have yourself to blame. The year is running faster. We're almost in June. If you don't take actions now, you are never going to take action again. And that sickness that is coming will come and hit you, and you have yourself to be blamed. Now, before the year runs, here are some of the tests that you need to do as an individual to be sure you are not having any underlying medical issue. Number one is your BP. BP should be checked at least once every week. Monitor your BP weekly. It is important. A lot of things can trigger BP. A lot. So monitor your BP every week. Number two, check your sugar level. Check your sugar level. Number three, check your cholesterol, your lipid profile. You check for your low density lipoprotein, high density lipoprotein, triglyceride. You check for total cholesterol. Those parameters, check them. So if you are at risk of developing any cardiovascular disease, then you notice it and do something about this immediately. Lipid profile will help prevent diseases like arteriosclerosis, myocardial infarction, the rest of the cardiovascular diseases. Liver function test. Run a liver function test, especially those of you that take alcohol, those of you that take all manner of drinks. Run a liver function test for yourself to check all the parameters to be sure that none of them is spiking up, to be sure that none of them is skyrocketing. Kidney function test, renal function test, or EUCR, any of the above, they are all kidney function tests. Run a kidney function test for yourself so you know either you are at risk of developing any kidney disease. Recently, I made a video about taking water, a lot of that because of the numbers of patients we have in dialysis, ward and all of that. Monitor your kidney because it might be failing and no symptoms will surface. It might be failing, no symptoms will surface. Check your kidney. Check your full blood count. Full blood count to monitor everything about your blood. If you have any infection, you're at risk of developing any blood-related disease, and full blood count to monitor it. Full blood count to tell you, so you can take precautions. For women, go and run a mammogram. If you run a mammogram, it will reveal if you have any. Women above 40, anyways. If you're at the risk of developing breast cancer and all of that. Now, pelvic scan will tell you if you are at the risk of developing any form of fibroid and all. We check your pelvic organs generally. Pap smear will check if you're at risk of developing cervical cancer. So women, take notes. For men, check your prostate. Do not neglect your health. Do not neglect your health. I know you are all busy. I know you are all busy trying to, make it out for yourself, but while you're busy, while you're working, go with your health. So take note of this test I just mentioned. Run this test. Run this test. You have someone to review it for you. This is the problem. This is what you need to do. This is what you need to correct. This is what you need to stop doing. This is what you need to start doing. Those are what we call preventive medicine. You're trying to prevent that illness before it comes. If you find this video useful, share this video to someone. Someone share this video to another person so we can save our society. We're trying to build a larger community where preventive medicine is practiced. That's the basic aim of this brand. Thank you.